Have you ever done Pilates before, by the way?
Never. This is my first, literally,
Brilliant.
virgin Pilates.
I always say that's such a good thing because then there's no bad habits that we have to undo or unlearn.
Oh, good.
To learn new habits. So it's actually great. Hi, everybody. Kate from Stretch Pilates, and I'm here today with Ayo. Did I say it right?
Perfect.
Okay,
perfect.
Cool. Yes. Tell me about your recent history and why you are here today.
I am a mom of two. So I have a baby. I'm breastfeeding. So
how old's the baby?
Well, she's 22 months.
Okay.
She's turning 2 soon, but we're still breastfeeding.
Okay.
I'm a bit of a stay-at-home mom situation. Cool. So I've been struggling a little bit with postpartum depression.
Sorry to hear that. I also did, so yeah. I can sympathize.
Thank you.
And I'm interrupting you. Your eldest child, how old?
He's literally a teenager. I'm joking. Okay. He's 8, but he's basically a teenager.
Okay, mine's 9, and I'm hoping he never turns into a teenager.
Maybe. I'm also 37 years old, but I feel like my back is a bit weird.
Okay.
And also something that I struggle with is like my neck.
Yes.
Because we're co-sleeping, so I tend to stay on the same, so I don't like. Yes. So there are moments.
And which side are you carrying her on?
I'm usually on this side. Okay. Right, but the bed, she likes this side. I don't know why.
Often the body works in slings. So if something there, it kicks out. So that's quite normal.
Yeah, no, I think you're right, because I have sometimes I
very
can't.
Tight.
It's tight, so I can't turn it, and I'll just wake up. Not that I'm like an energetic person when I wake up.
Yeah.
But I will wake up and then I can't turn my neck. Okay. It will hurt.
So and this will sort that out.
It will stick for like a day or two, and then I'll slowly do work up, I'll turn it. But this is like a recurrent thing in the last couple of months that I've noticed.
I'm going to show you some tips to deal with that. Cool. Is there anything else? Have you got any injuries or anything I need to know about?
Well, before I had Azaria, that's my daughter, I used to lift weights.
Okay.
Right. So sometimes I used to overdo it a bit. So I did kind of sprain.
Okay, so that's a tender spot that was susceptible to getting more issues later. Yes, probably. So that's why Pilates is going to be so good for you, is because gym is amazing, but if you don't have the technique exactly right and you're not engaging your core correctly, then you can pick up injuries.
Actually, that could be right, because I think my form wasn't good, because I also think the back, because I used to do the...
Yes, deadlifts.
Yeah, deadlifts, and my back hasn't really recovered. And I feel like now that I'm a mom, it's worse.
Yeah. Okay. Got you.
Yeah.
Perfect. Okay. So what we're going to do is we're going to do a little bit of an assessment, and we're going to teach you how to activate your core muscles and how to breathe. And then I'm going to do a little bit of a release for you in your neck and upper back. And then we're going to do a few basic exercises, some on the mat. Maybe if we have time, we'll pop to the reformer. And then we'll see how you're after the session. And hopefully you'll be hooked and want to come back.
But Kate, I do struggle with back exercises because of my back.
That's fine.
Okay. I'm excited but nervous.
So the interesting thing is, so people think, oh, my back, I mustn't use my back or hurt.
Yeah.
You actually have to use your back. You have to use your abs and so we've got core muscles around. If you can imagine that the bones of the spine are like my fists here, one on top of each other, and you've got the innermost core muscle around there. It's called your transversus abdominis. Anatomy has ridiculously long names, even harder to spell than to say, but we call it TA or TVA for short. But I like to think of it as your corset muscle. So corset is drawing you in and stabilizing you before you move.
Or for your posture.
Function. Yes.
Right.
So in the front, you've got transversus abdominis, TA or TVA for short. And in the back, you've got a feather-like muscles, group of muscles called multifidus, and they form the same function. So those muscles immediately around your spine are the muscles that we want to make sure are strong, so that you can be stable before you do any kind of movement. Because if those muscles are not working, then everything else is trying to compensate, because your body will still do what you want it to. Your brain is telling it to work. It's going to find a shortcut, or so it's not going to follow the correct path. It's just going to shortcut something to get there. And that's when you're going to pick up injuries.
Got it.
Okay, so to activate the transversus abdominis, you're going to place your index fingers onto your 2 hip bones for me.
Here
at the front. Yes. And then you're going to move your fingers slightly inside and give a little very flu-friendly cough or laugh.
Oh, I felt it.
Did you feel that muscle?
I felt it.
Okay. So that is your TA. So it's not, it gets confused a lot with pelvic floor.
Right.
It's not your pelvic floor muscle.
Right.
Okay. So to activate it, you need to pull it away from your finger. You felt it push into your finger. That's how you felt the muscle.
But like a contraction almost.
Yes, but to activate it, you've got to actually pull it in the opposite direction. So it's almost like you're pulling your skin gently away from your gym pants. You're gently drawing it away from your gym pants.
Like a retraction almost.
Yes.
Got it.
And another way I like to think of it is if you think of your two hip bones and you're trying to draw them closer towards each other.
Right.
So you're trying to get these bones to be closer together than they are.
Right.
That feeling.
Got it.
Yes.
I just did it now.
Yes.
Got it.
So the hardest part though about TA is because we need it to be active the entire time you're awake, it only needs to be active 30%, which is super hard for us to get our heads around. So it just needs to be switched on. It's not a hardcore like, workout. You know, like you clenching your fist or whatever. That it's not maximum effort. Right. It's 30% effort. Okay. Because you want it to be an endurance muscle that lasts and is active the entire time you're awake. Because you need to be able to stabilize your spine the entire time you're awake. Okay, so it's only switched off when you're sleeping. And it's very much a mind-body exercise. That's why they say Pilates is very mind-body focused. You've got to really think about which muscles you're activating, and that actually strengthens the neural pathways.
Is it almost like to the muscle. Yoga? No, so
it's different.
Right.
But that's why it's important to think about the muscle that you're wanting to activate so that your brain recognizes which muscle it needs to activate. Does that make sense?
It does.
So TA, you have to think about a lot, and that's why people often leave a Pilates session mentally exhausted as well as physically tired because you've been thinking so much about what your body has to do.
So you have to be intentional.
Yes.
Got it.
Okay.
Got it.
So that's activating TA, and then we're going to go into breathing. So breathing in Pilates, because we need to activate the core, we still have to breathe at the same time. So we breathe into our ribs. So I want you to place your 4 fingers in front and your thumbs behind. So on your ribs. Can you feel your rib cage?
I can.
Okay.
I can't. I'm sorry. I've never touched my body like that. I'm sorry. So this is new to me.
Okay.
I can feel my rib cage.
Yes. Breathe into your hands. Breathe into your ribs. Can you feel them expanding? And then contracting when you breathe out.
Yes, they are literally moving.
Good.
I'm not joking. They're literally moving.
Good. So in Pilates, we try and breathe in through our nose and we breathe out through our mouth.
This is crazy. I've never touched my...
Yeah.
I can feel it.
So that's where you want to breathe into the ribs so that you can maintain contraction in the core at the same time. Okay. Perfect. Now we're going to do a roll down. So a roll down, we usually start and end our Pilates classes with a roll down. So I want you to imagine that you're standing against a wall behind you.
Right.
Your feet are fist width apart. So you can literally fit your fist between your feet. Okay. Perfect. Right. And that distance matches up with your bum bones, which are called your ischial tuberosities. You know those bones underneath that you can feel when you're sitting?
Right.
That matches up with that gap. Okay. Perfect. So imagine there's a wall behind you. Also for posture, these days, a lot of us are like this, even probably over your baby, you like this.
Yeah.
So there's lots of this forward head situation going on. Yeah. So you need to imagine that you're pushing the back of your head into a wall behind you.
Okay.
Okay. So standing up nice and tall, you're going to take an inhale in through your nose, breathing into your ribs.
Okay.
And as you exhale, you're going to nod your head towards your feet. You're going to keep about a 4-finger gap between your chin and your chest when you go down. Okay. So on an exhale, you're going to slowly peel your spine down. It's as though you're peeling away from a wall behind you.
Right. Oh, I got it.
Good. And then relax that upper body. Try and keep your legs as straight as you can, using your thigh muscles, your quad muscles to straighten your knees. From here, I want you to inhale into your ribs. Before you move, I want you to exhale and engage your abs, your tummy muscles, glutes, bum muscles, and hamstrings, back of the thigh muscles. And I want you to tuck your pelvis and use those muscles to slowly peel that spine all the way back up to standing. So it's like you uncurling back up to the wall. Okay, let's go again. Inhale into your ribs. As you exhale, nod your head towards your feet. So let your head move. Nod your head, relax these arms, and peel that spine all the way down for me. Good, just till it's comfortable for you. So Drop that, relax. Yes. Good. From there, you're going to inhale, draw in your abdominals. As you exhale, use your abs, glutes, and hamstrings. So get those muscles contracted. Tummy muscles, bum muscles, back of the thigh muscles, and use those muscles to slowly stack your spine, one bone on top of each other. So you're basically stacking your spine on top of your hips. Okay. So we want to avoid coming up with a flat back. We want to feel that curl in the spine. Okay.
I've never done that before.
Last one. Inhale into your ribs. As you exhale, you're going to nod your head and peel that spine all the way down, relaxing those arms completely. So there's no tension in that upper body. Good. Nice. Relax that head. Good. Now I want you to engage abs, glutes, and hamstrings. On an exhale, come up here first for me. So pull belly button to spine. Come up here, then come up here, then come up here. So it's like you uncurling back up against that wall. So your lower back's going to touch the wall first, then your middle back, then your upper back, then your shoulders, and lastly your head, and your ears end up over your shoulders. Good. Chin parallel to the floor. Nice. Okay, now I want you to come and lie down on the bed for me on our mat, which is a raised mat. Okay, so I want you to slowly lower yourself all the way down. Yep, perfect. Are you comfortable?
Yes.
Okay, I want you to bend your knees for me and place your feet flat on the mat. Good. So your heels are going to be in line with your bum bones. Okay.
This is the bum bones, right, Kate?
Yeah, your sitting bones. You know when you sit down and you can feel those bony prominences underneath your bum? That's your bum bones, or the correct anatomical term is ischial tuberosities.
I love how
we don't say to people, make sure you can feel your ischial tuberosities, because, yeah. Okay, so I want your pelvis. We're going to talk about a neutral pelvis now and a neutral spine.
Do you want my chin to be done?
No, you're perfect. Okay. So your chin to be in neutral would be, which it is now, is if you were standing up, your chin is parallel to the floor.
Right.
So that's the neutral position. Then neutral spine is the natural curves in your spine. So everyone should have a little bit of a curve in the cervical spine, the back of the neck.
Yeah.
Yep.
Okay.
And then a little bit of a different curve, like a rounded curve in the thoracic spine, which is at your ribs.
Okay.
And then a lumbar curve, a curve the other way, again, in your lower back. So everyone's slightly different as to how much of a curve they've got in each part of the spine, but it's important to have the curves in the spine. So sometimes people think, oh, I must try and get rid of that curve. It's not, we need a curve. So the natural curves of your spine is how your spine is naturally. And then often we'll pick up things like some people might have a scoliosis or have too much of a, call it vulture neck, like especially or tech neck is how we're calling it now, because there's so many people with computers and phones, but it's too much of a curve in the cervical spine.
Right.
And that obviously causes problems, because if you think about gravity pushing down on your head, if it's not in line with your spine, for your spine to absorb that pressure, there's a lot of pressure on your head, which is putting a lot of pressure on your neck.
I've never thought about it that way. It's wild.
So neutral pelvis is what we now are going to talk about. Okay. So for your pelvis to be in a neutral position, your pubic bone and your two hip bones, you think about them as a triangle. So if you put your index fingers together and your thumbs together, and they form and they form a triangle. So move your hands far down so that your index fingers are on your pubic bone.
So this is pubic bone. I prefer that name.
Yes.
Okay, pubic bone.
And then, so there, can you feel that that's flat now?
I can.
Which means you've got a little gap in your lower back.
I do. I can feel there's a gap.
Which is good.
Right.
So we want that.
Good. Okay.
So in most of the exercises in Pilates, we try and do those exercises in neutral, because we want the abs to work and we want the back muscles to work, the TA and the multifidus. If you tilt your pelvis and squash your lower back into the mat, do that for me now. Yes.
It's a bit uncomfortable.
Without lifting your shoulders up. It's hard. No, it's hard. Okay. But if you squash your lower back into the mat, other way. So tilt it this way. Like you've got a P underneath.
Oh, like that?
You've got a P underneath the back of your pelvis, or a bean, and you want to squish it. Squish it into the mat for me.
That.
Yes. So now your pubic bone is higher than your two hip bones.
Right.
So if we do most of the exercises like that, which is called a posterior tilt, then your lower back muscles are on holiday because they can relax and chill out.
So
and
what's
we want
working
them
now?
to work.
Shoulders.
Yeah, your shoulders shouldn't be big. It's because you're very tight. But it's your tummy muscles that are working, but we want the back muscles to work at the same time. Okay. So I'm going to show you we're going to go into the different tilts with the pelvis, because the great thing is if you can do this at home when you have lower back pain, it can help to relieve it.
Really?
Yeah. Okay. So we're starting in neutral. Then I want you to practice squashing your lower back into the mat. So squash your lower back into the mat. Squash my hand.
Okay.
Not with your shoulders, with your pelvis.
Yes. Oh, yeah, okay, yeah.
Can you feel that?
I can feel the difference, yep.
And keep drawing your tummy muscles in. Don't let them pop. Yes.
I must keep drawing my tummy muscles
in. Don't let them pop. So there's a misconception of like, oh, I need to brace. We don't want bracing in Pilates. We want you to draw those abs down. Okay, go back to neutral for me. Good. Now I want you to make more of an arch in your lower back, as though I'm trying to slide a pool noodle between your lower back and the mat. Give me more of a gap. Give me the biggest gap you can give. No, without lifting your bum up.
Okay.
Yes. Can you feel that? It feels quite tight, like a pull on your pelvis, on your lower back. Can you feel that?
Yes, I can.
Good. So this is called an anterior tilt, more of an arch in your lower back. So go back to neutral for me. Go back to squashing your lower back into the mat. Pull in those abs. This is a posterior tilt. Go back to neutral for me. Go back to an anterior tilt, so more of an arch in your lower back. Yes. Simply by doing that movement, forwards, backwards, forwards, you'll warm up the spine, and it'll start to ease and feel less sore. Okay. Do you think you've got that?
Feel more comfortable though.
Nice. Do you think you've got that movement in your brain down pat?
Can I just do it again?
Yes,
I'm sorry.
of course. No. So these are the foundations in Pilates. So if we don't get these things right, everything else that we build on top of it is pretty useless. It's like the foundations of your house. You need to make sure that they're secure before you build the house. So that's why we like to spend a lot of time on understanding your body.
Yes.
For you to understand your body and have body awareness and be able to activate TA and be able to get neutral pelvis, posterior tilt, anterior tilt, because everything off that, once we start doing all the exercises, it's important to have the basics right.
I think it's funny because I've always been active, but I didn't know that this exists. And it does I feel more comfortable, then I don't feel pain.
Yes, good.
Do you know what I mean?
Yeah.
I normally feel pain when I used to lift weights.
Yes. Okay, so now we're going to do a pelvic curl, which is kind of like, stay down, which is kind of like a bridge. I don't know if you've ever heard of that. I'm going to take you through it. So we're going to start in neutral.
Okay.
You're going to inhale, draw in those abdominals. As you exhale, you're going to tilt your pelvis and squash your lower back into the bed.
Kate, give me a minute. Okay.
I know that. I told you you'd be mentally tired as well as physically. It's a lot to think about.
It's a lot.
Yeah.
And you're calm and confident, but my brain is like, okay, wait.
It's okay.
Okay,
so draw it in and squash the lower back into the mat. So you're squashing a P flat or a bean flat.
Right. Okay.
No, squash it more. I want this pubic bone higher than the hip bone. I want there to be no gap here. No gap, no gap, no gap. Squash, squash, squash. Tilt that pelvis. What's your favorite fruit?
Pineapple.
Okay. A pineapple's not really squishy. So let's pretend you've got a blueberry underneath your back and you have to squash it flat. Inhale, draw in those abdominals. Exhale, tilt that pelvis and squash your lower back into the mat. Squash it flat, like you're trying to squash a pea flat or a bean or a blueberry or something. Okay, tighten the bum muscles. Push through your feet, push through your arms and lift your bum up. Curl your bum up without losing the tilt, without losing that tuck. So I want you to move your pelvis this way. Yes, can you feel that? That's much better. Lift your bum up, lift your lower back, lift your middle back, lift your upper back. Good. We're aiming for a diagonal line from your shoulders to your knees. Is that uncomfortable?
Yes,
just a little. Looks like. Okay, on the next exhale, slowly peel that spine down, one bone at a time, but starting with the upper back. Okay. So get that upper back down first, then the middle back. No, don't untuck. Keep this pubic bone higher. Yes. Middle back, lower back, and then your bum touches down and you untuck your pelvis back into that neutral position. Good. So at the moment, I know it's not very comfortable for you to do it. So we're not going to go as high as you would normally in a pelvic curl. But with practice, you will get there. Okay. So it's like a massage for your spine.
Mm-hmm.
So it's like each bone in your spine is a pearl. Mm-hmm. You've got a string of pearls on a necklace. The necklace is broken. It's just a long line of pearls. And that you wanting to pick up one pearl at a time, one bone at a time, until you're all the way up. And then the opposite on the way down. So you're wanting to put one pearl, one bone down at a time on the way down.
Oh, like dominoes almost. Got it.
Okay. Let's try that again.
Okay.
Inhale, draw in those abdominals. Exhale, tilt that pelvis. Good. Squash the lower back. Yes, that's much better. Squeeze the bum muscles. Lift the bum. Good. Lift the lower back. Lift the middle back. Keep drawing those abs in. Keep that tilt in the pelvis. Good. Lift, lift, lift. Keep pushing through the arms. Keep pushing through the feet. Nice. Hold it there. Keep breathing into those ribs. Don't hold your breath. On the next exhale, slowly peel that spine down one bone at a time. Don't let this drop before this drops. Let the upper back drop first. Upper back drops first, then the middle back, then the lower back. Bum touches down and the pelvis goes back into neutral. Can you feel it's wanting to also tilt to the side on one side? So the hard thing is to get it even on both sides of the spine, where the pelvis is stable, as well as one bone at a time, upper back, middle back, lower back. Well done. It's hard. Good. How's your neck feeling?
My neck is feeling very tight.
Okay. So now I want you to focus on pushing the back of your head into the mat. So let it be heavy. Then I want you to draw your chin down towards your chest without lifting your head off the mat. So keep the head down, exactly what you're doing. Can you feel a stretch?
Yeah, I can.
Good. And then release it back to the neutral position. Good. And draw it down again. Draw your chin down to your chest again.
Must I still push it into the mat?
Yes, keep pushing it. Can you feel that stretch?
Okay.
Nice. And then back to neutral.
I can feel it here.
Yes. Good. And one more time. Pull that chin down to your chest. Good. Lengthening that neck. Nice. Keep the head heavy. Try and relax that neck. And it's honestly a case of telling the neck muscles, it sounds silly, but telling the neck muscles to turn off and to relax. Not turn off, that's the wrong word. We need all the muscles in the body to work, but you need them to not be as tense. So you need them to relax. Good. Go back to neutral. Nice. How does that feel?
Much better.
Yeah. So these are little things that you can do.
I had a headache when I came in.
I'm not surprised.
Oh, no.
Yeah. These are little things that you can do at home when you have time to ease that neck and get that lower back eased as well. And those are the basic things you can do. I'm going to now put some balls underneath your shoulders. Where is the sorest part in your upper back?
Oh
no,
yeah.
Still that, yeah. Okay, so let's just move your hair out the way.
Sorry.
That's okay. So I'm going to put that there, and then how's that? Yeah, I can tell immediately. We've hit a trigger point. So you know how I said, send your breath to where it's tight and try and breathe through it?
Right.
Now is the time for that. So try and relax your shoulders as much as you can. Is the pain staying in one place or is it moving?
It's just going up here now.
Okay.
But when you initially put the ball, it was like it was triggered.
Yeah. So now just try and breathe through it and send your breath to where it's tight. So ideally you want to try and lie on the ball for about 3 minutes, but obviously it depends on how sore it is and if you can take the pain. And we don't roll on it, we just lie on that trigger point until it eases, and then we find another one somewhere. Because it's probably all around that area. Let me know when it starts to ease. What you can also do when it starts to ease is slowly move your head from side to side.
Can I do that?
And yeah, and you'll probably find it triggers it again or even more.
I don't think I can do this side.
Yeah, that's fine. Go the other side.
Yeah, the side is better.
Good. So how does that feel?
Yeah, much better. Feel relaxed.
Good.
I don't want to do this side.
Try that side. If you get a sharp pain, then obviously stop. But try it. It might actually help it. Okay, that's fine. Come back to the other side then.
Yeah. Okay, maybe let me try a little.
Okay, that's fine. Is it still like pulsing quite a lot?
No, it's actually calmed down a little bit, but if it's uncomfortable when I do it like this way, it's a little bit, I can feel it here.
Okay, yeah. So it's not only at the back that you'll be tight, it's also at the front.
Yeah,
there's so many muscles here that,
I didn't even realize that.
And that you can also fix with breathing. So you know how we're breathing? I've taught you how to breathe laterally into your ribs while doing Pilates. But if you are practicing belly breathing, which you can do lying at home just with your knees bent and your feet flat, I want you to put your right hand on your belly, on your tummy, and your left hand on your chest. A bit higher up. Okay. So I want you to breathe into your tummy, and I want your right hand to rise as you breathe in and fall as you breathe out. And I don't want your chest hand to move. So your left hand must stay still. So you're forcing the breath into your belly.
Okay.
It's hard. And it's especially hard after you've had babies, because then you think, oh, my tummy's out, I need to draw it in. And that's the worst thing you can do, because you actually need to just relax it. So that's going to help those neck muscles as well, is practicing this belly breathing. So let's keep going. Try. Breathe into that right hand. Then let that right hand rise. So hold it up a bit higher. Breathe in. And breathe out. Let it fall. And breathe in. Try and lift your tummy. Lift that right hand up as high as you can. As in like lift. Yeah. Good. Let it go. Like you're blowing up a balloon. And down. Good. 2 more. That's better already. And last one. Well done.
Okay. I don't know if we can do that. The blowing out. I've never done that before.
Yes. So you need to do that when you're not exercising. If you're lying down, like, it's a great thing to do if you're battling to fall asleep, actually, because it calms your whole nervous system. But it's very good because a lot of us are using these muscles to breathe, because we're chest breathing, we're shallow breathing, because we're running around and there's so many different things to do. We're not actually breathing correctly. So when you're doing Pilates, when you're exercising, to engage your TA, you need to force the breath into the ribs. But if you're wanting to relax and wanting to fall asleep, or just wanting to practice your breathing, that belly breathing is what you must do.
This is all new to me.
Yeah.
Thank you so much.
Which is why we're going to stop now, because otherwise there'll be information overload.
Yeah. When I came here, I didn't tell you guys I had a headache. So I do sometimes get headaches. Sometimes if I wake up and my neck is a bit stiff, it does come with the headache. So I came in with the headache, and I didn't realize that when I started breathing, especially when she put the ball here, it triggered a bit, and then immediately my headache went away. I know it sounds crazy, but literally, I haven't had coffee, guys. So I know I really have a headache. I haven't had caffeine. And as soon as she put it, it triggered the pain, but then the headache, like, it left. And another thing that really bothers me is sometimes I get anxious. When she was teaching me how to breathe, I covered it up by laughing a lot, but when she taught me how to breathe, I didn't feel so anxious.
Awesome.
I felt like I could take a nap. Do you understand?
Yes, I do.
What I'm saying? And I haven't felt that in a long time, because I'm a mom, so I'm always like go. So it was really good. I really thought I'd be more in pain, because my background is I used to lift weights before, and I used to do martial arts, and I just thought this would be very painful. But surprisingly, it is exhausting mentally, but I'm not feeling pain. You know how when you work out, they say like no pain, no gain? We're so used to that in that industry. I didn't feel pain here. I think I felt release.